good morning. Happy Orthodox Easter to all who celebrate. My question is a quick two-parter. The first is, will there ever be an opportunity for people who never tested positive because they couldn't get tests or they didn't want to waste tests for COVID to possibly give and donate plasma if they are certain, based on their symptoms, that they had it? And the second is for Dr. Barboa and Dr. Katz. I'm curious. I've heard from a lot of people who want to know, they've been in quarantine for more than a month. If they were sick, they've gotten better. But when can they see, not huge parties, but when can someone go visit a grandparent or another member outside of their immediate family who they haven't been in quarantine with? I think a lot of people are confused as to, do they have to wait till the pause is lifted to go see an aunt, an uncle, or a grandparent, or can they do that in moderation?
Katie, thank you for the question, and I want to join with you in wishing a happy Orthodox Easter to all who celebrate it. I'm going to let the doctors speak to it. I will only say, both on the question of the test, as I understand it, on the blood drive, as I understand it, the focus is on people who have a confirmed positive test, but the doctors will speak to that. But in general, I would say, as they speak to the question of, folks coming out of quarantine and what kind of connection they can have with their family and all, just to remember what we said weeks and weeks ago about the dangers facing anyone who's, over 65, over 70, and folks particularly have pre-existing conditions if they're serious, severe conditions. And then when the two overlap, those folks are in tremendous danger, and there needs to be real caution while we're still in the heat of this crisis. Remember, we keep going over these daily indicators, Katie, and we haven't really seen a sustained pattern of progress yet. We've seen something better than what we were experiencing at the beginning of April, but we have not seen sustained progress. That means this disease is still out there, and those particularly vulnerable people have to be careful. But Dr. Barbeau, Dr. Katz, why don't you jump in?
Thank you, Mr. Mayor. I would echo what you've said with regards to ensuring that we continue to protect the elderly, especially. One of the things that we have said since the beginning of this pandemic is that every day we learn new things about this virus. And the reality is that it wasn't until recently that we learned that people in the pre-symptomatic phase could transmit the virus. I think that it is yet to be determined how long someone can continue to shed virus. And so my recommendation would be that once someone has recovered from likely COVID-19, that they continue with the preventive recommendations that we have given with regards to diligent hand washing, continued use of face coverings, and maintaining that 6-foot distance from others. I think to the extent that family members do want to see one another in person, I would be very diligent about ensuring, again, that I limit visitors to elderly and that I put in place those 3 really crucial preventive measures to ensure that we continue protecting those that are at greatest risk.
Dr. Katz, you want to add on the plasma treatment or anything else?
Yes, on the plasma treatment, initially our focus is on people who are known positive, and the people who seem to make the most antibodies are people who have a major disease. People who have had a milder course don't seem to make as much in the way of antibodies. So that's part of why we're focusing on people with known infections. There may come a time when we're able to test other people as well, and some of them may turn out to have robust antibodies and therefore be plasma donors. But right now, we're focused on people with a known positive.